a number of calls, emails, and others over recent days and weeks about events in Kansas City, what our advice will be, etc. It is clear thus far that in Kansas City, as compared to cities in the coast of our country and other cities around our country, that we have not had the number of confirmed cases that they've seen. Indeed, in Kansas City, Missouri, thus far we've had 0 confirmed cases. That doesn't mean that we won't be diligent and try to make sure we're protecting public health. We have a few things to say for you today. The first of all is this. There are some who have asked rather plainly, will we call off the Big 12 tournament, our St. Patrick's Day parade, weekend events in Kansas City, etc.? The answer to that is no, at least at this point. We don't currently have enough information to suggest that there is a public health threat to the broader public in connection with attendance of or carrying on those events. And so we'll continue to proceed with those events in Kansas City. What I will note, however, is that as events change, and they may change rapidly, we will certainly update you with that information up to and including our need to change our planned recommendations with any number of events. To talk about further, perhaps, the types of folks who should be attending and who should not, the way we look to address certain public health precautions is Dr. Rex Archer. Dr. Carney will respond to talk to you about how you should address either symptoms or illness currently and how we address it with Kansas City EMS services. And then we'll come back to answer any questions you might have. Dr. Archer.
So first of all, these are not mandatory events for the general public. We do caution folks, particularly those that are over 60, those that have underlying conditions, whether it be heart disease, lung disease, immune challenges or problems if they've been on chemotherapy, pregnant women, to very strongly consider not participating. Now, what I do want to emphasize, though, is that for folks that are over 70, the risk continues to go up with this disease in regards to serious health complications, including hospitalization and potential death. So as you get up towards 70, and if you have underlying conditions, then I'm actually strongly recommending that you not attend. So I think that's really where we want to make this clear. Over 60, regardless whether you have underlying conditions, we think you should consider thinking about not attending. Over 70, I really don't think you should attend, and I'm really strongly recommending that you not. And then underlying conditions, it depends on how severe those conditions are, so you can kind of do your math with that.
Thank you.
Thank you. Good morning. And to agree with what the mayor and Dr. Archer are saying, that is exactly what we are recommending on the healthcare side as well. If you have anything in regards to a comorbid condition, which includes high blood pressure, heart disease, lung disease, you might be pregnant, if you live with individuals who have these types of diseases, we are recommending that you do avoid large gatherings. On top of that, if you come down with symptoms and you are younger, we recommend that you avoid going to nursing homes. If you can stay out of the emergency rooms or out of the hospitals, we also recommend that as well. In lieu of going to the emergency room, it might be appropriate for you to call a primary care physician and visit them instead. We would also like to encourage you in the healthcare infrastructure, if you are having issues with high volume already with the flu and RSV, use this as a time to prepare and talk about what you would do if you would get more patients, and continue to wash your hands and not shake hands.
As the sign says. And thank you. And we'll note that we've got a lot of questions from community organizations, businesses, et cetera. First of all, we won't at this point substitute our judgment for theirs, but we think these directions are frankly good ones so far, something we're using with the city of Kansas City. We have not shut down events en masse. We continue to have our workforce showing up. That said, certainly if people have signs of illness, making sure that it's clear to them that they can not come to work is vital. Also, looking to slightly more restrictive travel policies, we think, is something that's important, particularly as it relates to non-essential travel. And Dr. Archer had noted previously, and so I'll steal a little bit of his thunder, he's following his own recommendations by giving up some tickets to a number of Any-
there a threshold of
Okay.
numbers of people being ill that you feel like you have to hit before you start thinking we need to close these things down?
So it's a combination of both the number of folks, how much is it actually looking like it's moving within our population, and the severity. Some of you may already be aware that we've got some concerns that there actually may be two different forms of this virus, one that is more dangerous in regards to health implications, the other one that may be a little bit more transmissible, and so that's still being evaluated. I mean, literally anything that we say this morning at this press conference could change slightly by this evening, and so the lucky thing is we can call you and let you know, and we can change those recommendations as this moves forward. Washing your hands, using the elbow bump. We know that if you shake hands versus the high five, you'll transmit twice as much bacteria versus a fist bump 10 times as much if you're shaking hands. So that's the reason for the not shaking hands and kind of changing that culture within our country right now.
Can the virus be transmitted by mosquitoes?
There is no evidence that the virus can occupy mosquitoes. It actually appears to have come probably out of bats. So it's more of a mammalian. It's not a insect vector virus.
Anyone else?
I know that the fire departments and medics in other parts of the country, Seattle specifically, began to see issues, in clustered areas. Anything along those lines that you're hearing about within the ambulance corps here in Kansas?
That's a good question. So being on the front lines, our pre-hospital personnel oftentimes will experience something before the greater population does and start to see little signs and symptoms of things. We've been talking very closely to the EMS agencies and fire departments around the nation and also around the world to see what best practices we can use here in our own region to help protect our personnel, but also our patients. Whenever we've got a state that is already experiencing this, it is kind of helpful for us to talk with them and learn from them and their experiences. So that's what we've been doing daily, just like Dr. Archer has said. As those recommendations change, we will be right behind them, changing our recommendations if necessary.
But any alarm bells going off here in Kansas City?
The biggest thing currently is practicing appropriate protective equipment. If anybody is symptomatic with a respiratory issue, now's our time to practice appropriate protection and just get used to those procedures, how you put that protective equipment on, how you take that protective equipment off, and how we communicate that with the hospitals that are receiving those patients.
And you're talking about specifically for the medics to be protected?
Medics, firefighters, and emergency department personnel as well.
How available are test kits in Missouri?
So this has been, unfortunately, one of the big challenges with some problems that occurred in the initial development of the test in this country. There is still not the capacity that we would like to see in public health. I'd love to have the availability of tests to where I could be doing some random screening in emergency rooms with people that have similar symptoms to this virus. We don't have that capacity right now. Having said that, though, because we're not on the vanguard of this, the other cities we're watching, seeing their experience, seeing the growth rate of the disease, that's why we're comfortable with the recommendations today. The one thing I would add is people really shouldn't be visiting nursing homes right now. This is where most of the deaths in the state of Washington have been occurring. So we really, really need to protect those populations. And absolutely, if you think in any way, shape, or form you're ill, you should not be visiting a nursing home. But and many of the nursing homes actually are already starting to take positive steps of not having visitors. Some hospitals around the country are starting to move towards not having volunteers come in as we're dealing with this outbreak. So this will be, we will be giving general guidance and recommendations, but each organization has to also work within those guidelines.
What would it take?
I would also like to emphasize that the hospitals in town are not, if you would like to receive a test of COVID-19, you cannot show up at the local hospital to get that test at this time. So if you have concerns, the best course of action is to either contact a primary care physician and/or the health department.
And the advice, you might want to remind them about calling before you go.
Yeah, if you are symptomatic, we recommend that you call before you go into the public, just to help protect other individuals.
So who gets tested and who does not get tested? What are the big differences of those?
So literally, we're sending out, we've sent out 6-7 advisories to the medical community on changes that are occurring in the availability of testing since January. Right now, as we speak, we're looking at people that have connections to places where the virus has been, have been exposed to people that we know have had the virus. And then if you are hospitalized and serious enough kind of conditions where we've ruled out everything else, then you can be tested. That was the case in California that kind of broke the situation where they finally gave in to that testing. For just routine folks that are not that ill to be hospitalized, see, one of the things that people are used to, well, you need a diagnosis to treat something. At this point, we're treating based on symptoms. There is no specific treatment for this disease. So actually narrowing down the diagnosis doesn't change the treatment outcomes. What it can change is recommendations on self-quarantine. So we still would like to be able to have those tests, and eventually they'll be available. Right now, we're just being very cautious.
What's it going to take to change the recommendations?
Mostly availability of the private sector to augment what we're getting also on the public sector in regards to testing. So once we can get enough tests to be run, then we can start changing those recommendations.
Like 5 cases?
And one of the things that I hate sharing information before it's been finalized, but several of the insurance companies are having discussions about eliminating co-pays so that people can get tested privately and not have co-pays. Also, a real strong recommendation is folks that have medicines that are really life-sustaining, try to start building up extra supply. And some of the insurance companies are looking at waiving those requirements where you can only get your medicines refilled ever so often, where you could actually start to store up some of those. So we'll be seeing more of that also.
I think one last point I'll make, and this is something that Dr. Archer taught me. I've heard somewhat troubling narratives in the community sometimes from people who might be younger who say, well, either great, I have nothing to worry about, or it's not an issue that impacts me. First, you should be concerned for your own health, but Dr. Archer noted something that's important. Be concerned for the health of others, transmitting this virus to others as well. That's why we encourage the no handshakes for everyone. That's why we're encouraging good hygiene for everyone, whether they're 5 years old, 50, 85, anything under the sun. We have been fortunate thus far in Kansas City to not have more cases, and what we don't want to see is that high volume of increases with the rapidity that you've seen in some other cities and areas lately. And so this is why our focus continues to work with containing this virus as long as we can, which gives us the time to build up those things like hopefully treatment resources, etc. So just make sure everyone listening knows that this is relevant to them, pertains to them, and really do worry about everybody else in our ecosystem as well. So that's it. Thank you.